Hi, I'm Kirk. I'm the student nurse. I'll be demonstrating MedAdmin today. So we're just going to show you the med cards first. So we got warfarin here. Put both sides over. Ibuprofen. Put both sides over. And Ciprodex. Show you guys that. Okay. Alright, so now that's out of the way, we'll check the... Make sure that the MAR and the physician's orders match up correctly, and that we're administering medication safely. So, the name, Bilirubin. Names match up, Bilirubin, date of birth, match up as well, February 21st, 1961. FIN numbers match up as well, doctors match up. So allergies next. Okay, no allergies. No allergies. Ibuprofen, 600 mgs oral twice daily. Ibuprofen, 600 mgs oral twice daily, 8 o'clock. Safe to administer, yes. Warfarin, 2 mgs oral daily. Warfarin, 2 mgs oral daily. Take at 8 o'clock. Hasn't been administered yet. We're safe to administer. Good. Ciprodex, 1 drop both ears, twice daily. Ciprodex, 1 drop both ears, twice daily. 800. Hasn't been administered yet. We're good to administer. So, just gonna wash my hands here. First, sanitize my hands before I start touching heads. I'm just gonna grab each one here. So, first thing we have is ibuprofen. So, ibuprofen is for pain and fever, and it inhibits the COX-1, COX-2 pathway, and ultimately the prostaglandin synthesis. So, like I said, it's going to be used for fever and pain. One of the implications we're going to have to deal with is just gastric discomfort and gastric bleeding, as well as dizziness. Dizziness is the main one. And the safe dosing range is 3,200 mgs per day. So, I'm just going to put that one aside here. Also, so since we have 600 mgs here, and these are 200 mg tablets, we're going to need 3 tablets of this. Next one is Ciprodex. So for Ciprodex, it's going to be a corticosteroid, so it's going to suppress inflammation. It's also going to have some antibacterial properties from the ciprofloxacin. And some of the side effects it's going to have is going to be a rash and itching, and the corticosteroid can have effects if it goes systemic, so we're going to have to watch that as well. And safe dosing range is like about 4 drops a day, so we'll stick that there. So we're within the safe dosing range for those two. Also, needs to be checked for taking the expiry dates on every medication we check, and Ciprodex is fine for expiry date. Ibuprofen is also fine for expiry date. So next we're going to grab warfarin. So we need 2 mgs of warfarin. These come in 1 mg cases, so we're going to need 2 tablets of this one. And check the expiry date. Expiry date's good. Next one. We'll check the morphine card here, and morphine is an anticoagulant. It decreases the synthesis of vitamin K. Coagulation to affect coagulation factors and decrease clotting. So it's mostly for the prevention of thrombosis. So we're going to give this to our patient to lower his clotting and reduce his risk of clots. Safe dosing range is from 2 to 5 mgs daily. I think you can go up to 10 though. So some side effects you're going to have with this is dizziness, fatigue, and headache. And we're going to make sure that patient's not going to be using any other medications or changing their diet that's going to affect their liver enzymes, which could change the level of warfarin in the blood. And we're also going to want to check their prothrombin at the time. So just how fast their clotting system is working. Okay, so should be good to start getting meds in. We're going to need 2 water cups, so 2 pill forms. We're going to need 2 cups for pills. cotton balls. Okay, we'll start doing this.
No, well,
So the first one we'll do is Warframe. We need 2 tabs of Warframe.
Anyway,
2
okay, let's
MGs.
go. Ready?
And these are 1 and 2 things.
Alright, my name is
So we're gonna use the lid to get our Warframe tabs out. So we got 2 tabs here. Throwing 2 tabs in here should be good.
So first thing that I'm going to do is
So we're gonna need a label for our Warframe as well.
so I'm going to check to have
2 MGs.
first 1961.
Date and time is December 14th.
Dr. Sanders. There are no allergies
800.
either.
And signatures.
Medications.
And then that's 2.
Dose. This is just my second time doing it, so I'm going to do the initials. So we have we need ibuprofen 600 milligrams oral twice daily. We have ibuprofen 600 milligrams oral twice daily. Warfarin 2 milligrams oral daily. We have warfarin 2 milligrams oral daily. We need Ciprodex 1 drop both ears twice daily. Ciprodex 1 drop both ears twice daily. Perfect. So now what I'm going to do is
So the Warframe's good there.
I'm just going to pull out the medications. We have Ciprodex.
So next one, we're gonna put the Warframe away. We're gonna grab ibuprofen. Ibuprofen.
I'm going to check.
We need 600 mgs. Do 200 mg tablets. So we need 3 tablets. There's the lid here.
Warfarin.
So 3 tablets there. So ibuprofen is also good. Grab the label here. Mark down the ibuprofen.
Before setting the medication.
Patient name, bilirubin, drug name.
Before the Ciprodex is in antibacterial
Dose is 600 mgs. Date and time, December 14th. 21 at 800. Signature UM2.
With that first one, that was
Safe dose, 4 drops for 7 days. So we can't really go past 7 days.
Yeah, that was a good one.
4 drops per year.
That's good as well.
Side effects.
So our ibuprofen's good there. Next is Ciprodex. So we need 1 drop both ears twice daily. I don't really, we don't need to take anything out of here, so I'm just gonna make a label for it to remind us to take 1 drop both ears. Bilirubin, drug name.
Ibuprofen. So, antipyretic, anti-inflammatory, so it's for people
1 drop both ears twice daily.
on the COX-1 and COX-2
I'll watch it with like the.
But he could tell you if you're
So
doing
yeah,
marijuana.
analgesic, safe dose for an adult, 200 to 400.
Time December 14th.
I'll watch it and look at the.
Okay, as you read it. Adverse effects could be headache, dizziness, any like stomach discomfort, constipation. Before administering, I will check their lymphocytes, check their temperature, and look for anything.
Right, so now
Like depending on where they're.
we have all our medications prepared. We're just gonna go over
Next, and then we have warfarin.
we go over the MAR again. Compare our MAR to
So
here, MAR. To our labels and our labels and containers as well. So we got Ciprodex here.
So
And we need Ciprodex 1 drop both ears twice daily. I got Ciprodex 1 drop both ears twice daily. And then 14th, bilirubin. So 14th, UMSN2. So haven't taken it yet. We're safe to administer.
the most important one is bleeding. So we would check
Next is ibuprofen. So we got bilirubin.
abdominal bleeding or
We got ibuprofen 600 mgs oral twice daily.
pain, any
600 mgs.
on the body, which probably just
December
to
14th.
watch out for.
800 has been taken yet. We're good to administer.
Obviously assess the lab tests beforehand, and then we would reassess them later on after. And yeah, we would just let the patient know, check for any X-ray, be careful around things.
Just for the ibuprofen.
Yeah, adverse effects.
Just to confirm this ibuprofen and there's 200 mgs. We need 3 of them. 3 tablets, 600. And
Okay.
twice daily. Should be good.
So, we are going to
With the warfarin.
set the medication
Warfarin.
now.
These are 1 mg tabs. We got 2 tablets for 2 mgs. We needed 2 mgs orally, twice daily for warfarin. Take it 800. Doesn't take me up. We're going to administer.
Ibuprofen first. I'm just gonna wash my hands again. We have our ibuprofen. We need 600
Should be everything we need for.
of ibuprofen. So at 8 a.m. will be our first dose. So we have
Make sure I have everything I need before I leave here to go to the room.
tablets
So we should be good to
for this
go.
dose.
So before I leave, I have all my meds here. I have the cotton swabs I need. I have the water glass I need. I have my medical administration record, regular cards, and I've listed off side effects and I've listed off mode of action of each drug. And should be good to go.
So setting both the nurses do like 10 seconds for each patient.
So as we walk into here, we're going to be checking the general survey, just making sure the patient is safe. The call bells within reach. There's nothing on the floor cluttering up. No, I don't wash my hands.
You watched it?
We can introduce ourselves to the patient here. I'll actually bring a table around this side. So. Hello, Mr. Goodler. We're going to introduce ourselves to the patient. So, hi, I'm Kirk. I'm your student nurse today. And we're going to confirm the name of the patient. So confirm that we're going to check the armband. Can I check your armband? We're going to confirm. So you're Mr. Billy Rubin. We're going to confirm the name with your armband as well. And we're also going to confirm the allergies. So, and I also want to confirm you don't have any allergies, or you don't have any allergies. And that your birthday is February 21st, 1961. The information is correct, yes. Okay. So, should be good to go. Let's do my third check here. And education. So I just want to, the first one we're going to go over is warfarin. So we'll check here. We'll check warfarin. Warfarin at 2 mgs from Mr. Billy Rubin. And I have warfarin 2 mgs oral daily and 800 mgs, or 800 at time 800, not 800. We have 2 mgs. Okay, so warfarin should be good to administer. Ibuprofen for Mr. Billy Rubin. Ibuprofen 600 mgs oral twice daily. 800. We're good to administer. And Ciprodex. So Ciprodex is 1 drop both ears twice daily. 1 drop both ears twice daily for Mr. Billy Rubin. And it should be good there as well. So we're just gonna educate our patient on warfarin. So just want to tell him that warfarin is for just to reduce the risk of clotting. We were worried about his clotting, so or developing clot. So we're just gonna. So before we do this, we're just gonna make sure that we have a prothrombin time, just so we know how his clotting doing. We don't give him a medication that's dangerous to him. And also to not take any grapefruit juice or just change your diet when you're taking warfarin, because it could affect liver enzymes. Should be good to get this med. So we're gonna take the water, just the warfarin. Just gonna sit him up here. Here, I'm just gonna raise you in the same position so it's safer to use your head. Should find him out. Okay, there we go. Sure, we'll try this again. So warfarin, here. So I'm just give you the warfarin here. It's very plenty. And water here as well. So the warfarin is administered. I'm just gonna sign off on the warfarin administration here. Next, we're gonna do the ibuprofen. So before we do the ibuprofen, we're gonna want to monitor the patient's pain level. So, Mr. Billerman, how's your pain doing today? It's around a 4. Okay, that's about within the ranges. And for all the medications we're administering today, for the warfarin, Ciprodex, and ibuprofen, we're gonna want to have a vital check. So we'll have a vital check record before we've done this. So for the ibuprofen, it's gonna be this is for your fever and your pain. And we're going to want to also check your kidney function as well. So we'll do a creatinine test as well. So with the ibuprofen, you might experience some dizziness or drowsiness and a headache. And after we give you some med, we'll also assess your pain. And if you have any report blurred vision, ringing in the ear, should let us know immediately. And also, do not drive if dizziness occurs. So we should be good to go here. I'm going to give the ibuprofen. There we go. Water as well. Make sure he swallows it. Any pill form, we should always make sure they swallow it. Okay, and for the last here's that one. So for the ear drops and Ciprodex, we're going to want to use gloves because we don't want to get into contact with any of the earwax on the patient. We're also going to lower our patients back down because further the eardrops are up better. Lying flat on their side. So for the Ciprodex, it's going to be an antibiotic and also a corticosteroid. So it's going to reduce inflammation and it's also going to be an antibacterial for the ear. So it's mainly going to be used to treat infections in the ear. Side effects we can have are burning, itching in the ear, and a rash. So we're going to want to monitor. We're going to want to monitor vital checks for this so we can make sure that it's not going to stomach. Education for the patient. So when we're administering this med, we're going to put you on have you lie down with your head on your side. And we're going to have you sit there for 10 minutes to make sure the med's working correctly. So, here. Grab a cotton swab. Can I just get you to tilt your head on your side? We're going to open the ear canal and administer the 1 drop as it mentioned. And we're going to stick our cotton swab here as well. And hold it there for 10 minutes. So 10 minutes up now, so we're going to flip them over. Can I move your head to the other side? Okay, yep. Move your head over to the other side. Open ear canal. Administer the drop. Put a cotton swab here for 10 minutes. 10 minutes is up, so can I just return your head? Yeah, there you are. Turn the head here. In real practice, we would use a separate cotton swab, but to avoid wasting, I use the same one. I will immediately discard of my gloves, safe procedure, and sanitize my hands. And then we'll do our exit checks. So exit checks and education. So we'll continue to monitor your pain. We'll continue to check your clotting using a prothrombin test. And prothrombin test. And we were also documenting each med after we administered them here. I didn't do one immediately after I administered the ibuprofen, but I should have. So, like I said, back to education. So, like I said, for the ibuprofen, we're going to monitor your pain level and also level of inflammation. And warfarin, we're going to be monitoring your prothrombin time for your level, just and generally your clotting factors. To make sure they're working correctly and we're not overcompensating for it. And for Ciprodex, we're going to monitor how your infection is going, along with regular vital checks. And other than that, just to make sure that your general safety check is done and that the Caldwell is within reach. Caldwell is within reach. And that the safety check is up, safety check is good, and the patient is comfortable. So, did you want anything else from me today? Are you comfortable? The patient is comfortable. So we should be good.
But I think that for like
So we administered ibuprofen, warfarin, and Ciprodex today, and we mentioned all the side effects of each drug, their indications, the vitals we're going to check, and what we're going to be monitoring on the patient as well. Okay.